Hi, I'm Dr. Tim Lind, and I'm going to answer some questions that I get from emails from patients or potential patients or phone calls I get from people that they commonly ask questions about thyroid, about their specific condition. And I'm putting this together because a lot of the questions seem to be the same questions over and over. I see a lot of people with thyroid conditions in my office. We treat them naturally and we get tremendous results. So I'm going to just give you some of the questions that I have. A common question is, if my lab tests are normal, why do I still have symptoms even though I'm on thyroid medication? Well, that's a really good question. That's probably the most common question that I get. And that can be a two-part answer. Number one, on the testing part of it, there are, for the most part, when I look at someone's lab test results, when they bring the information in here, they bring in TSH and free T4. Now, those are two good lab tests that need to be run, but you can't fully evaluate the thyroid. There are 6 different major problems that the thyroid can express, and within those 6 there can be 24 different functions. And just by checking those 2 alone, you're going to miss an awful lot of stuff. In fact, with those 2 tests, you can check for primary hypothyroidism. And primary hypothyroidism is if TSH is high and T4 is low. Usually if someone does have hypothyroidism, first of all, they don't enter my office, and you wouldn't be watching this if you had primary hypothyroidism, because what happens is you can take the medication, Synthroid, levothyroxine, Cytomel, or Armour, or some other thyroid med, and you would feel a drastic change in your symptoms. You'd feel a ton better. So those 2 tests are really good for primary hypothyroidism, but it doesn't take in consideration the other 5 different mechanisms going on. So that kind of answers that question right there. Another question I see, this one lady wrote, I was diagnosed with Hashimotos Thyroiditis. There has been no change in my current treatment and I still feel horrible. Is there anything I can do? Well, first and foremost, people need to understand what Hashimoto's thyroiditis is. And Hashimoto's thyroiditis is an immune system condition. It's an autoimmune condition. And in Hashimoto's, what happens is the body, the immune system literally attacks the thyroid. So it's actively destroying the thyroid. So by treating the thyroid, you're really not going to see much change at all because it's an immune system condition. The immune system needs to be addressed, and that's where I approach it, and that's where I focus my time and energy on. Now, some people can also have underlying thyroid conditions, but you need to get the immune system checked and evaluated. Well, how do you do that? Well, you do lab testings on that. There are different tests that can be done. Believe it or not, a basic blood panel, CBC with autodifferential, is going to give you some information on that. It's going to let you know the different types of white blood cell count, and you can kind of see, is it active or is it not active. So that's always the first place that I start. But people need to understand Hashimoto's thyroiditis, or autoimmune thyroid, is an immune system condition and not a thyroid condition. And I see an awful lot of autoimmune conditions. As a matter of fact, recent research basically says now that 70 to 90% of people diagnosed with thyroid, with hypothyroidism, they're actually autoimmune thyroid. So something to consider there as well. Another question I get is, what types of treatment do I do? Real common one there too. First, people need to understand my philosophy or my view on things. I treat the person and not the diagnosis. Most people, if you have been diagnosed with, let's just say, primary hypothyroidism or anything else for that matter, the diagnosis is made and the diagnosis is treated. I don't do that because everybody's different. A diagnosis may be made, but the person needs to be treated, and the person needs to be treated as a whole. Interestingly enough, if you look at common hypothyroid symptoms, which are can't lose weight, low energy, sleep disturbances, dry skin, hair falling out, headaches in the morning, those are just to name a few. there are a lot of other conditions that have the same exact symptoms as that. So you can't really treat the diagnosis, you need to treat the person. So once you find out, looking at the blood chemistries and through different testing, once you figure the things out, then you can start treating someone individually, not the diagnosis, which is really, really, really important to me. How can you treat thyroid conditions without medication? Well, once again, it comes down to what is the mechanism causing their dysfunction. Okay, that is another part of my philosophy on how I deal with people with thyroid or any other condition for that matter, any other chronic condition. Some people need to take thyroid medication the rest of their life. It just depends, especially if they're autoimmune. A lot of times you don't know how much attack has been on the thyroid gland, so you don't know how much destruction is there, and some people are going to need some help with that. They're going to need some type of thyroid medication to monitor and regulate a certain amount of thyroid being produced. The same token, you need to find out is there a mechanism going wrong that can be fixed, so to say, where they can either get off their medication completely or decrease it drastically. And that's kind of where I view things at. Now, every individual is different. I could explain 5 different mechanisms, but they may not pertain to you. So that's based on my, the consultations, the paperwork that someone fills out. It gives me a lot of good information, my exam process, and also the lab. So, labs are very, very important. Most labs, when people do bring labs in here, they're not complete labs, so we need to order complete labs so we can see everything that's going on with the thyroid. A lot of times too with thyroid, it's non-thyroid issues, and what that means is something out here is affecting the thyroid, causing the thyroid to malfunction. Thyroid may be working well, but something, an outside influence, may be influencing either hormonally or whatever, blood sugars, or a lot of different things that can alter it. So the thyroid may be normal, actually it's more common than you would expect, but you need to find out what is directly or indirectly affecting the thyroid that can make someone feel like they do. And another question I get from time to time is, can I treat someone that doesn't have a thyroid? Well, sometimes people either have their thyroid radiated or thyroid completely surgically removed. And the answer to that is sometimes yes, sometimes no. When they do a surgical procedure to remove the thyroid is really small, weighs about an ounce, and it's kind of like this gushy material. It's very, very hard to remove. It's not like a heart or liver where it's a solid mass. It's not solid at all. So most people still have some type of thyroid gland still functioning to some degree or another. One patient I just recently consulted with, she had one side of her thyroid removed. Well, she's got one active side. So can I treat somebody with that, or can I help someone with that? And the answer is sometimes yes, sometimes no, but you need to do a lot further more investigating to figure out what the mechanism that caused that to not work right in the first place. I hope this answers some of your questions. I do have more information on my site here. I also give workshops. I have a lot of information that may help you with your problem. If you are watching this, the likelihood of you not getting the care or not getting the results that you want is pretty high. Otherwise, you wouldn't be here in the first place. So I encourage you to email me or call me at my office. I do workshops a lot. I have, like I said, more videos which will help give you more information. Thank you.